the charge chapter and other things. So the idea that the things that are most profitable in healthcare are not the things that produce the most health is the disconnect. And what I mean by that, I had the great honor to speak with Speaker Newt Gingrich when he was primarily a healthcare guy. And I said, this is the line I typically use when I talk to the Wall Street Journal or other types of places, that if we aligned profits with health, then I wouldn't have problems with profits because the monies would be going to the right things. And so what do I mean by that? So if I were to ask many of you, what are the most valuable things that we do in healthcare? Some of you, if not many of you, would say vaccines. And it turns out that our work in Michigan, now it's probably 5 or 6 years old, showed that over half of community-based pediatricians lose money vaccinating kids. And then when I asked the speaker, well, what do you think those pediatric practices have to do to make up for the losses they incurred for doing what many people thought was the most valuable thing they could do? Of course, he said right away, do a bunch of stuff that really doesn't help the kids very much. The people ask me all the time, well, low-value care is challenging. But you know, the folks who showed up in the large firms that put VBID in place, who saw their visits to see nurse practitioners and they saw their insulin's cost sharing be cut in half, and they were actually not discouraged, but actually made easy for them to go to see the eye doctor, no one complained about that. And I think that if we put in the right balance, which is what I argue with for anyone who works with me, well, the idea of removing low-value care to a payer is so attractive, almost red meat, because the savings are immediate and substantial. I think that what we've shown in the management of certain chronic diseases, that we could actually get to cost neutrality by having people be healthier, by having greater amounts of visits, and most importantly, filling their evidence-based indicated drugs. And I'll just again put it as a second thing, is aligned with the current recommendations that people stay within their tiers. And the worrisome for me with the VBID demo in Medicare is there's this term that I'm just getting used to in this town called PAYGO, is that to get the VBID demo to expand, we have to show that the programs that we have for the 10 chronic conditions have to be cost neutral at year 5. And while there are some conditions like congestive heart failure for the non-clinicians room, lots of avoidable hospitalizations, that's why people are jumping in that direction. But having advocated for other conditions like mental health issues like depression, we got rheumatoid arthritis added as well with dementia last time around, because I really wanted to see these demonstrations fall into those conditions where hospitalizations were not the cost drivers, but other issues would.